attenuation of the hypogastric plexus, the sacral sympathetic efferent fibers from the second, third, and fourth sacral nerves, and by a few filaments from the first two sacral ganglia. The sensation for pain for the patient is mainly due to impulses passing by sensory pathways down the lateral and posterior portions of the cervix into the area of the cardinal and uterosacral nerves. Paracervical block injects a medication in this region to block the impulses leaving the uterus at this junction. Because of this variation, there is variability in the technique used to achieve a paracervical block, and this may range from a very simplistic 2-quadrant or 4-quadrant paracervical block in which the bulk of the material is injected into the uterosacral ligament region. However, it may be more complex where a component of the block involves an intracervical injection as well. I'd like to demonstrate for you here a very simple 4-quadrant technique for paracervical block. Once the cervix is visualized, the anterior lip can be grasped with a single-tooth tenaculum for manipulation, after which a small amount of anesthetic is injected at 2 o'clock, 4 o'clock, 8 o'clock, and 10 o'clock. In each case, this is injected in the immediate submucosal region so that a small wheel of anesthetic is raised. Prior to injecting the anesthetic, aspirating the syringe will ensure that you're not in the intravascular space. After the injection, the anesthetic will dissipate into the adjacent tissue, thus delivering the anesthetic to the nerves.
Experience has shown that patients undergoing an outpatient office-based endometrial ablation can receive significant anesthetic benefits from a paracervical block. The medications for paracervical block are pre-mixed prior to the procedure. Initially, the paracervical medications are injected into the 12 o'clock position of the cervix after aspiration to allow the tenaculum to be comfortably placed. Next, a small wheel of medication is placed at the 3 o'clock, 9 o'clock, 5 o'clock, and 7 o'clock positions of the cervix submucosally. Great care is taken to aspirate to avoid any intravascular administration of the medication. After the initial wheel has been placed, then a second, deeper administration of the same anesthetic mixture is placed again at the 3 o'clock, 9 o'clock, 5 o'clock, and 7 o'clock positions. A total of approximately 20 to 25 cc's will be administered throughout these 4 places upon the cervix. After the dose had been successfully given, the instruments are removed, tenaculum removed, speculum removed, and the patient is taken out of the lithotomy position for 5 minutes or so to allow the patient to be comfortable, but also to allow the medications to have full effect.